Hi, everybody. The research I did for my presentation today was on the Diabetes Self-Management Questionnaire, which I will be referring to as the DSMQ. So a quick overview on my presentation. I will be going over DSMQ's history. I will be providing you all with more information on its design and more description information. I will be going over instrument evidence. And lastly, I will be providing an analysis and recommendations for further use of the DSMQ. The DSMQ was introduced in 2012 by the Research Institute of the Diabetes Academy of Mergen fame. And since then, it has been thoroughly evaluated and used in both Germany, the United Kingdom, and the United States. Collaborators included 5 psychologists, 3 diabetologists, and a sample of 15 diabetic patients who all helped in reviewing and narrowing down the items on the questionnaire. And the purpose as to why the DSMQ was developed, it was to assess diabetes self-management and self-care behavior. And audiences of the DSMQ include type 1 and type 2 diabetics and clinicians to make use of the tool itself. So constructs that are being measured in the DSMQ are dietary control, medication adherence, blood glucose monitoring, physical activity, and physician contact. And the reason why these constructs are being measured is because studies have shown them to be predictors of glycemic control. So medical adherence and diet are important predictors of type 1 and type 2 diabetes. Blood glucose monitoring impacts glycemic control, while physical activity has shown to help metabolic control in type 1 diabetes and improves hemoglobin A1C in type 2. Physician contact frequency also affects glycemic outcome. So higher frequency in physician visits has been shown to be associated with better glycemic outcome. As for the measurement of these constructs, a higher score indicates positive self-management behavior. Therefore, reverse scoring is required for negatively keyed items. From all the items on the questionnaire, 7 of them are formulated positively, while 9 are inversely to what is considered effective self-care. And overall, from the questionnaire, the goal is to get a sum scale score with an estimate of 4 subscale scores. While one of the items, which is one of the questions on the questionnaire, is going to be an overall rating of self-care, and that question is going to be included in the sum scale score. So data for the DSMQ is collected to the questionnaire itself. The questionnaire consists of 16 items covering the 5 different aspects of diabetes self-management. And all questions on the questionnaire are referring to or are asking a person to refer to the last 8 weeks of their diabetes self-care. And the reason why they're referring to the last 8 weeks is because hemoglobin A1C levels, those are time dependent, therefore 8 weeks. And all questions are asked to reflect the person's point of view. So here is a quick visual I created so everyone can have an idea of what this questionnaire consists of. So like I mentioned, there are 5 different categories being looked at for diabetes self-care. So one of them being diabetes management. So questions regarding blood sugar, how a person cares for their blood sugar levels is going to be included. There's also physical activity, and questions are going to be asked on how active a person is and whether or not they avoid physical activity. There is healthcare use, and a person's going to be asked whether they keep all their doctor's appointments. While dietary rating, that's going to include questions as to whether people make choices to eat foods that create optimal blood sugar levels, or whether they eat sweets or foods rich in carbohydrates. And then the last category is dietary control. And that one is looking at overall, a person is going to be asked to rate whether their diabetes self-care is poor or not. So evidence of reliability. Reliability refers to the degree to which research methods produce stable and consistent results. And in relation to the DSMQ, 7 studies were reviewed to confirm overall good consistency. So some values that were looked at in terms of reliability for internal consistency, the Cronbach's alpha proved to be a good score at 0.84. And there was also consistency within the subscales, which were glucose management, dietary control, physical activity, and healthcare use. And a retest correlation was also done, and that score came out to a 0.40. There is also the values of inter-observer and intra-observer, but those were not applicable to the DSMQ because this questionnaire is self-reported rather than observational. As for measurement error is observed through random error and systemic error. And the DSMQ is self-reported. Therefore, to minimize error, the health information done that was collected from patients was not only collected from them, but from their case files as well. And also this questionnaire, because it is self-reported, for participants who are illiterate, they were provided, the questionnaire was also administered if needed. Overall, looking at the DSMQ, a few strengths include that studies did show that this DSMQ to be valid and reliable. And overall, like one of the most important goals when it comes to diabetes treatment is good metabolic control. Therefore, the DSMQ can be valuable for clinicians to use as a screener and to assess barriers that their patients face when it comes to diabetes management. And lastly, the DSMQ is translated in many languages and is easily accessible. As for weaknesses, the DSMQ is not suitable for primary care settings. It's mostly used in clinical settings. And I also noticed that questions regarding accessibility are not included. So for example, questions on the questionnaire do not include how accessible is purchasing fresh fruits and vegetables. And also, for example, when it comes to seeing physicians, there wasn't any information or questions about how easy is it for a person to get access to their provider. And then lastly, because the questionnaire is self-reported, participants may answer questions in a way that they think is going to be desirable. So overall, the DSMQ is helpful in identifying barriers that people face when it comes to managing their diabetes. And we can say that it is a valid and reliable tool that can be put to use. But the only recommendations I have at the moment would be to include questions regarding accessibility, which is key when it comes to identifying barriers. So here are my references and a few acronyms that I mentioned in my presentation. Thank you all for listening. And if you have any questions, please feel free to leave a comment.